And joining me now is the person who made that possible for her, Karen surgeon, Dr. Rachel Blublom-Langer, plastic surgeon at the University of Maryland Medical Center. Thanks so much for coming in to talk to us.
Thank you so much for having me.
And she said everything went well.
It did. It went really well. I think Karen completed a great journey.
Well, and you know, everyone, it's important to point out, is not necessarily a candidate for gender reassignment surgery. How do you determine who's a candidate and who's not a candidate?
To some degree, it's a personal selection or a personal choice. The journey for each transgender person will be different. Some will stop at never having taken hormones. Some will take hormones, and some will go on to have surgery. If the patient does select surgery as part of their journey and transition, we make sure that all their comorbid conditions are well controlled, and we follow the WPATH guidelines, so the World Professional Association of Transgender Health. And these are guidelines to ensure a safe and excellent outcome. So they have been seen by at least 2 mental health professionals for bottom surgery. Most of them will have been on hormones, overseen by either a primary care physician or an endocrinologist. And then, of course, they will have been evaluated by their internist to make sure that they are suitable for surgery.
Now, when I talked to Karen, she said that she gave herself 5 years before she got to this point, and I guess that's obviously so there's no regrets.
There is a prescribed period of time where the patient lives in their gender, the gender to which they're transitioning. They become comfortable with that transition, both at work and in their home life.
Recovery time, and how long is the surgery?
Of course, it depends on what type of surgery you're having. So some gender-affirming surgeries are shorter, and they're outpatient procedures, and the recovery is perhaps 2 weeks. For other surgeries, bottom surgery, it's a longer recovery. It's an inpatient hospital admission, and the recovery is more on the order of 4 to 6 weeks.
And Karen talked about that this really is something that you even see with children. This is not really a choice. For some people, it really is a yearning to be someplace where they're not the correct body, I guess.
There's a clear diagnosis, and that's gender dysphoria. It's not a choice. It's the way the individual was born.
She said that she does a lot of active speaking with families and spreading her word, and she just wanted to give people a look into who she really is. All right. Doctor, thank you so much for coming in to talk
Thank
with
you for having me.
Hopefully going in focus and giving us a better understanding. Sending